How do checkpoint inhibitors treat lymphoma? Imagine your immune system as a team of soldiers ready to fight off invaders. Sometimes, cancer cells like lymphoma can hide from these soldiers by activating safety switches called immune checkpoints. These checkpoints tell immune cells to stand down, allowing the cancer to grow unchecked. Checkpoint inhibitors are medicines that block these safety switches, helping your immune system recognize and attack the lymphoma cells more effectively. These drugs are monoclonal antibodies, which means they are lab-made proteins designed to target specific molecules. The main targets are two key immune checkpoints, CTLA-4 and PD-1. CTLA-4 acts early in the immune response, mainly in lymph nodes, where it suppresses T-cell activation. When drugs like ipilimumab block CTLA-4, they lift this suppression, allowing T-cells to multiply and become ready to attack cancer. PD-1 works later in tissues, where it keeps T-cells from overreacting. Drugs such as nivolumab and pembrolizumab block PD-1, reactivating exhausted T-cells so they can recognize and destroy lymphoma cells. In lymphoma treatment, checkpoint inhibitors have shown impressive results, especially in relapsed or refractory classical Hodgkin lymphoma, with response rates often between 60 and 80%. In other types of non-Hodgkin lymphoma, responses are generally lower but still promising, ranging from 20 to 40%. These therapies work by changing the tumor environment, which is usually filled with immune cells that are enabled to attack the cancer effectively. Checkpoint inhibitors help these immune cells identify lymphoma cells as threats and eliminate them. Beyond just removing the brakes on the immune system, checkpoint inhibitors also boost T-cell activity and can enhance natural killer cell functions. This means they not only help T-cells attack but also amplify other immune responses against the lymphoma. Currently, drugs like nivolumab and pembrolizumab are approved for use in relapsed or refractory lymphoma cases. Researchers are exploring combinations of checkpoint inhibitors with chemotherapy or other targeted therapies to improve outcomes further. It's important to remember that checkpoint inhibitors work by empowering your immune system rather than directly killing cancer cells. This new approach has opened up more options for patients who previously had limited choices. However, because they activate the immune system, side effects related to immune activation can occur and need careful monitoring. Treatment plans should always be personalized and discussed with healthcare professionals who can evaluate individual health status, disease characteristics, and prior treatments. As research continues, these therapies hold great promise for improving lymphoma care, but always seek expert advice to determine the best approach for each person.